Okay, let's talk about Taiwan's news. Measles outbreak. So let's first talk about the recent outbreak of measles has raised domestic and global concerns. As of there have been 6 confirmed cases of measles in Taiwan. All reported cases are locally infected, suggesting sign of cluster infection. Most of the traces of the carriers occurred in Zhonghe. This virus is transmitted through air. Airborne diseases spread through coughing, sneezing, laughing, and close personal contact with patients or carriers. This virus is highly transmitted and can be transmitted fast airborne. In other words, it is transmitted fast through small respiratory droplets. Exposure to carriers will increase the risks of infection. Patients were identified to be infected with measles due to close personal physical contact with families or being exposed to the virus in public places or medical facilities. Patients who are diagnosed with measles tend to develop symptoms such as rash, fever, and fatigue. Early stage symptoms resemble those colds, so early diagnosis may be wrong. After a patient contracts this contagious disease, the average incubation period is 13 days, and the maximum is 18 days. The estimated peak of the cluster infection is expected occur in mid-March. The authorities urge resident citizens to remain on high alert as it is highly transmittable and has a long incubation period. When you develop the symptoms, you should seek medical assistance and timely treatment. Patients are advised to avoid going to public places. The authorities suggest keeping the masks at all times. Besides, medical officials and the authorities urge medical pra- practic practitioner personnel staff to get vaccinated to prevent infection with the disease. In conclusion, social distance, mask protection, personal hygiene, and vaccination play a key role combating this highly contagious disease.